Hey there, Middle Tennessee. I am Daniel Adams, and I am today with Dr. Kent Lofley at Blue Ocean Family Medicine. How are you, Dr. Lofley?
Doing well. How are you today, Daniel?
Excited because I've been learning a lot more about Medicare, and I want to share today what most Middle Tennesseans don't know about Medicare. Now, obviously, Medicare starts at like 65 plus. Is that correct? Like you turn 65, and that's when the Medicare conversation happens?
Yeah, exactly. When people are 65, they then can enroll in Medicare and start to get those Medicare benefits.
So if somebody does have Medicare, why would they come in to Blue Ocean Family Medicine?
Yeah, that's a great question. Uh, People who have Medicare absolutely can come into Blue Ocean Family Medicine. And I do have several patients that have Medicare who like to use our services. And mostly it's because of a few things. Um, right now, people are having a difficult time getting in to see their doctor when they would like to. So it's not uncommon for someone to decide, oh, I need to have a physical or I need to get in to see my doctor to get my blood pressure medication refilled or whatever it is. And they're told, oh, we can get you in a month or 2 months, right? There's a long wait. And so that's one reason that people like to come to Blue Ocean Family Medicine, because our waiting time for a new patient is usually 1 to 2 weeks. And if you're a member of the practice, if you have something come up where you're sick or some injury, we can usually get you in the same day or the next day.
So same day or next day, instead of talking to a gal, getting transferred to another gal and getting scheduled out 8 weeks, 6 weeks, 12 weeks, whatever it is.
Yeah. So that's one huge benefit that I see that people on Medicare use by coming to this type of practice. And so they can get in and be seen. The other part is they like having the longer visit time that we allow at Blue Ocean Family Medicine.
How long do
So
the
you go to
visits
it.
usually go?
Yeah. So our visits are standard 30 to 60 minutes. Our first time visits and physicals are all 60-minute visits just to give us enough time to really have a conversation. So I can get to know the patient, they can get to know me, and we can make the right decisions about their health.
Does that make, I mean, the last time I went and saw a direct care physician, I talked to the nice little nurse gal for whatever it was, 8 minutes while she took my blood pressure. And then the doctor came in and pushed on my stomach twice, sent me out, and charged me $200. I saw him for maybe 6 minutes.
Yeah.
But it's different for y'all.
Yeah. When I say that our standard appointments are 30 to 60 minutes, that's face to face time with me as a doctor, 30 minutes or 60 minutes, enough time to really have a good conversation and do a good exam and then have a discussion about what we want to do for treatment and make a decision together about what's best.
That sounds so attractive to me. It's like it's something that finally makes sense. Instead of
Yeah.
having to sit in the waiting room for, it's like it's a half day event, right? Anytime I got to go sit in the waiting room forever and navigate all
Yeah.
because y'all are like one central office, right, in Hendersonville?
Yeah. So it's one office. So if you call into the office on any given day, you may speak to the office manager. A lot of the time I'm answering the phones. And so uh, it's not uncommon to call Blue Ocean Family Medicine and talk directly with me.
That's the kind of care I appreciate. It's that person to person, and that's I feel like that fits Middle Tennessee, right? It's like a place where people take time to stop and shake hands and look each other in the eye, and things are a little slower here in the South. And I appreciate the option that healthcare can fit that.
Yeah, it feels really nice to be able to, as a doctor, not feel like I have to rush through the visit to get to the next patient. To be able to take the time and really get to know them and then know that we're coming up with a really good plan for their health.
It was powerful. One other question that came up, how does your practice handle specialist referrals for Medicare patients?
Yeah. So if you come and enroll in Blue Ocean Family Medicine, even though it's direct primary care and you pay us a monthly membership fee, you can still use your insurance for everything else. So if you need to see a specialist, I can refer you to the specialist. You can use your insurance with the specialist, and there's no problem with that. It doesn't, being a member of Blue Ocean Family Medicine doesn't void your insurance or make it so you can't use it for anything else. And the same goes for if they want to get medications at the pharmacy or laboratory tests, or we need to do some type of screening tests like a colonoscopy or mammogram or anything like that, that can all be taken care of with the insurance.
Well, it sounds like the best of both worlds. So I can, knee replacement, hip replacement, whatever, like, of course, that's going to go out to a specialist. A lot of the diabetes stuff can be done right with you, right? Like same day or next day, like you mentioned. And then if I've got these bigger procedures, like that'll take as long as it takes. We're going through insurance. It's that whole process.
Yes, exactly.
Those are great distinctions. So is there a number that I could call to enroll, even with Medicare?
Yeah, so just call the office, 615-266-6465.
Dr. Lofley, certainly appreciate your time today. Appreciate what you're doing for our seniors. God bless you.
Thank you. Have a good day, Daniel.